Good. So we can wait a few more minutes, but then we'll get started soon to make sure that we're on time. So welcome everyone to our workshop on how to get rid of back pain without giving up the activities you love. My name is Cindy Thibodeau. I'm a physiotherapist and the founder here of MOOV Physiotherapy. And I'm really happy to have my two co-hosts here, Jason and Aslan from MOOV. And thank you guys for being here today and for sharing your knowledge with our listeners. That's well appreciated. Okay. So yeah, again, in case anybody has missed, just make sure you're in the chat that it's all panelists and attendees. That way everybody can see it, and then we'll get started. So before we go any further, I want to say a big thank you to Metcalf Massage Therapy Clinic. They helped us promote this workshop and getting the word out. So we're super happy to have them as, you know, a downtown core and thinking like healthcare practitioners. And then, and that way we can work with them and get our patients better even faster. So thank you, Metcalf Massage, for helping us get the word out. That was awesome. And then Metcalf Massage was super generous, and they are offering 2 awesome giveaways, 2 free massages. And so we'll be doing spin the wheel after the workshop, so that you can enter your chance to win one of those massages. If you basically, to get your name into the draw, all you need to do is participate in the chat, okay? So you can either type in when we ask questions or go on mic when we give you the opportunity to do so. So yeah, so if you're excited for this free giveaway, type free in the chat to get your chance to win this. Can you guys hear me well? I hear one comment saying that they can't hear me. Everybody seems good otherwise. Okay. Okay, thanks for your feedback, guys. Okay. Good. Okay, so, okay, that's great. Perfect. Okay, let's get started, okay? So the reason why we wanted to do our workshop today on for people that have been struggling with persistent lower back pain is because as clinicians, we often get people in the clinic and they basically tell us that they've been having this lower back pain for many years. And then basically they have to give up the stuff they love. They have to stop their sports, stop their hobbies. They've tried maybe treatment in the past and it, you know, didn't help, and they just felt that this was supposed to be the way life was, right? So they kind of gave up a little bit. And what we're really hoping with this workshop today is that we'll be able to provide you the most up-to-date information regarding pain, and then basically our most valuable tips that we found with our clients, like when we get our big wins with clients that have been struggling with back pain for a long time, okay? So I'm curious to know, like in the chat right now, can you tell me who's having back pain right now? Like, is there anybody that is struggling with back pain today? Just type pain in the chat if that's you, okay? So a couple, yeah, and don't be shy, guys. Like, I mean, we're all in the same boat here, so we'll be able to get exclamation marks there. Yeah, we'll be able to get more help if you guys participate. Yeah, exactly. So maybe not right now, but on a regular basis, eh, Julia? Yeah. Okay. So, and if basically, like in terms of like follow-up questions, like what would you be doing right now if you didn't have back pain? Like, what is it, this thing that it's stopping you from doing? I'm just going to look in the chat here and see what people are answering. So definitely lots of people are struggling with back pain, and some of them is today and others is like throughout the week. And then, yeah, moving, sleeping, sitting.
Home rentals.
Not sitting on a pillow on the floor, picking up the kids. Yeah, home rentals, running, walking. Yeah, they're super common, right? Yoga. Yeah. So like we see, like back pain is super common. Like 4 out of 5 Canadians will get at least one episode of lower back pain in their lives. And unfortunately, almost 20% of these people will have persistent back pain, okay? So you're not in this alone. And then our goal with the workshop is that by the end of it, you leave with at least one piece of information that you can get started and have an impact on your pain. Okay, so that's our goal. Okay, so yeah, so Jason, would you be able to, like, because like we just said, it's super common, the lower back pain, but you know, the presentations can be so different. And if we take the example of like a lifting injury, like you bend forward and lift something, like what are the different causes of having the back pain when somebody has a similar injury to that?
So I guess, yeah, using a lifting example, often in the spring, I think as physios, we can relate to this because of a lot of our patients get back outside, want to do some gardening. So they start moving potted plants or bags of dirt. They bend forward and they'll feel like this jolt of pain in their low back. And then not too long after, sometimes they want to come into physio, etc. So the first one, which is called local tissue disruption, or a lot of people just know it as tissue damage, is a very common type of situation that we will see in physiotherapy. It's pretty straightforward stuff. We're talking about in the area where the people are experiencing the pain, it's either they've injured their muscles, the vertebral bodies, those are little bones, the front of the spine, the joints in the low back, or intervertebral discs between the vertebral bodies, or even their ligaments. So what's happened is that they've bent forward, they try to lift up the potted plant, and they've overloaded and sometimes caused maybe some tearing in some muscles or the ligaments. So yeah, so those are some of the structures that can be affected. When we see our patients in the clinic, very often these patients will present with their posture being affected. They seem to be leaning towards a side to maybe avoid putting pressure on the other side or what have you. So sometimes they're either, they're kind of shifted over because they don't like they're shifted over towards the left, they don't like putting weight on their right side, or they're bent forward because if they go to straighten up, that just causes too much pain. And for us, right off the bat, we see this and we think, okay, there's something going on structurally with these people. Usually there's also, sorry, go ahead.
No, go. I was just wondering, how long does it take for those type of injuries to heal?
So typically tissues will heal in about 12 weeks. It's just Mother Nature running her course. People get better. The tissues get more resilient over the course of 12 weeks. The beauty, though, a lot of people kind of fear is, especially early days, their pain can be quite significant. So they're quite fearful. They're thinking, hopefully this pain isn't going to last forever, or am I stuck with this pain? Typically with tissue disruption, we're talking about 4 weeks for pain to kind of settle down. At this point in time, especially for us here in the clinic, this is a moment where we let our patients feel safe, comfortable getting back into their activities, so that they can but focus on educating them so that they're able to get back to their activities over the course of the next 12 weeks, but do it in a nice, safe manner so that by the 12th week, we know that they're fully resilient, they're able to go back to doing the things that they love. They can go back to maybe hopefully lifting those bags of dirt and potted plants, etc., very comfortably without any fear whatsoever.
That's good. That was helpful. How many people in the chat feel like that they connect with that explanation, that they feel that they maybe had an experience of like those back pain? So type in tissue if you feel that represents what you've been going through. So a couple there. Okay. Yeah, sometimes that's a common, like we often see that one, but then often, like Jason said, they resolve on its own. So that's good. So don't be shy, people, share, okay? So that's good, Jason. Can you tell us more about the second type of presentation that people can get in terms of back pain with a similar lifting injury?
Absolutely. Peripheral neuropathy is another one that we have that's quite common, and probably a few people on this chat will have experienced as well. So when we're saying neuropathy, we're talking about nerves. I think a lot of people get that. But when we're talking about peripheral neuropathy, we're talking about the nerves that are in the periphery, the nerves that exit the spine, go either down the back of the leg or through the front into the groin, down into the thigh. The one that goes down the back of the leg is the one that I think a lot of people kind of get a bit freaked out when they hear. We're talking about these nerve roots combining and becoming the sciatic nerve. So very often in a lifting or activity where people are, you know, let's say doing their gardening, they're going to bend forward, but if they have stiff, tight joints in the low back, or maybe some tight muscles in the glutes or into the hamstrings or what have you, the sciatic nerve can kind of find itself getting a little bit pinched, and people are going to feel like a sudden jolt of pain that later becomes more of like a burning pain, sometimes a shooting pain. And it can be kind of unrelenting for people. And the way I like to explain it is nerves are like a memory foam mattress. And the second you compress them, okay, they can remain compressed for a little bit of time. And it takes, so depending on the severity of the compression, it can take quite some time for it to kind of reinflate and go back to moving properly. So some people will get quite frustrated because they're like, it's kind of like this burning pain doesn't want to let up. Sometimes it can last for good hours on end, just after having done maybe just a simple stretch where they thought it was okay for them to do at the time. They will find that there's maybe a limitation in their movement because the nerve is pinched. So what we call like a neural tension, it's the nerve that's getting either pinched by the joints or into the muscles, and they can no longer flex forward, or you have trouble kind of lifting your leg to, like, you know, maybe put on some socks or your shoes or what have you.
So to summarize, basically they're slower to heal, and then their pain travels down their leg.
Basically, yeah, that's how it kind of presents it. So they might not necessarily feel anything in the low back, and that's one thing a lot of people will say. Yeah, but it doesn't make sense. I don't feel this in my back. It's that they mostly feel the symptoms going down that leg.
So who in the chat type nerves, if you feel that you may have experienced this, like either you've been told you had sciatica or you're fearing that you've had it. So yeah, a few here again, right, that have been struggling with this, maybe a little bit more. Okay.
Pretty common.
Yeah, the third category that we have, can you tell a little bit more about that last one, Jason, that last presentation?
Yep, totally. Central sensitization is what that is. It falls in the chronic pain category. So let's go back to the spring. You're doing your gardening, you feel your jolt of pain. But then the weeks go by, the months go by, we're into summer, then we're into the fall. And yet this pain, which might not have been by the fall, it might not be as severe as what it was in the spring. It's calmed down a little bit, but it's still there. It's still annoying you. It's still nagging you. It's basically relatively constant enough that over time, what's happening is you are training your brain to kind of react to what's going on. And when we're saying central sensitization, we're talking about the central nervous system. So that's your brain and your spinal cord. And so the frequent signals that that you're sending out to the brain, your brain is like it'll learn. It's like anything. When you were a kid and you were learning to ride your bike, it took some practice, but it took some repetition, and eventually you were able to ride a bike. And now I'm sure you get on a bike, no problem. You don't even think about it. Well, it's the same thing. That's your brain kind of going on autopilot, moving you on your bicycle. Well, it's the same thing for the brain. The brain is receiving these signals, and after a while it goes, yeah, the low back department is not working for me. So the second there's anything abnormal, or that I just think, okay, that might just be a little bit threatening, I'm going to like fire those muscles. I'm going to stiffen everything up, and I'm just going to let her know, or I'm going to let him know that what they're about to do might be dangerous. So let's just protect the body. So central sensitization basically is that.
And their presentation compared to the other two, what are the differences there?
Basically, when patients show up, they're
You're
going to
cutting
say
off
things.
here a little bit, Jay.
Oh, can you hear me?
Yep.
Everything? Yeah, good. I don't know what doing this does, but apparently I think it helps.
Okay, that's better now. I don't know if listeners are
Yeah.
still hearing. That's better. Okay.
Straightening my posture out. So where their pain initially presents, it can change over time, as well as the type of pain kind of changes. It can go from a constant to maybe an intermittent type of pain, a burning to maybe shooting type of pain. And sometimes the patients are going to feel like it's migrated. It's gone from one side of the body, and now I'm starting to feel it in various other areas. People are also going to who are going through like this persistent type of pain are going to complain of maybe some issues in like other systems as well. They're going to say they're going to have problems with digestions, maybe hormone imbalances, migraines. A big one is their mood. They're a lot more irritable. They also find that they're going to report stuff like in moments of stress or anxiety, it seems like their pain is a lot worse, or the other areas also seem to be a bit more affected.
Okay.
So yeah, that's because the brain is kind of being a little bit overloaded by all the stimulus and is having trouble dealing with the low back pain and also life at the same time.
Okay, so to summarize, the pain lasts for longer, it starts to travel, but a little bit more spreading maybe is a better way of saying it, and maybe some of their other systems are also being aggravated during this time. So absolutely. How about this category, like who feels like that their symptoms are kind of match more this, like there is not really a big reason behind their pain, like that it's hard for them to figure out. Yeah, so definitely some there, eh? Yeah, thank you for that. That was awesome, Jason. And yeah, exactly, like I see number 2, number 3, yeah, for sure. So that's an important point, because clinically, to be honest, like we see a mix of these, right? So it's rare that it will just be one. It can happen, but often it starts as one and then it migrates to another. So yeah, that's a very good point. Great, so Eslin, can you help us clarify some of the myths and beliefs around lower back pain, and then just also helping us understand pain in a better way?
Yeah, absolutely. So let's talk about one of the biggest myths in pain is the myth that the amount of pain you are in indicates the amount of damage being done. So we know this could not be farther from the truth. The truth is that pain is a poor indicator of how much damage there actually is. We can use the example of a paper cut or even biting your tongue. These examples usually cause quite a bit of pain, but they very rarely lead to serious tissue damage. In contrast to these, the biting your tongue example, there's many serious injuries that require immediate treatment or even surgery and can often be associated with minimal or no pain at the time of that injury. So if we think examples of those, it could be when someone ruptures their Achilles or blows out their knee, and even people with disc bulges develop them, and when they're unsure when these injuries actually occurred. People reporting these injuries often report little to no pain. So it's just important to see that these examples highlight the importance of understanding the difference between tissue damage and tissue sensitivity.
Yeah.
And really understanding that when pain persists for weeks and months and years, that structures are becoming more sensitized, they're not becoming more damaged.
Yeah. That's great. That's awesome. Who does that make sense? Everyone, like type in sensitive if you feel like you understood that it's not necessarily equal damage, but more of a sensitive nervous system. Good.
Excellent. Good. So I'll just roll into the second myth. The second myth here is basically the myth that chronic pain means that an injury has not healed properly. And again, the truth here is that, like Jay touched on, is that following an injury, tissue healing occurs within 3 months of that tissue damage occurring. So if pain is persisting longer than that 3 months, it's very unlikely related to the tissues and the fact that they haven't healed. It's more likely linked to the sensitive nervous system. So this sensitive nervous system can be the result of many contributing factors. So just to name a couple, like stress can change our nervous system, fatigue, new activities that you start doing, previous injuries you've had, and even the beliefs and the expectations that you have about your injury can change your sensitivity. So keep in mind, these factors can also lead to the fluctuations we feel in our symptoms, or what we call flare-ups. So I guess putting this all together, this helps us to understand why maybe a poor night's sleep, or maybe we've received some bad news, or we get more stressed at work, why these things can often cause an increase in our symptoms. And conversely, it can explain why we often feel less pain when we're on vacation or having fun with friends.
Yeah,
so
absolutely.
Basically, to summarize, most low back pain flare-ups do not occur because your tissues haven't healed. It's rather due to the fact that the nervous system has become irritated in some way, and we've got to figure that out.
Yeah. Basically, so if pain doesn't equal tissue damage, and it doesn't mean that the injury hasn't, healed well, what does it mean?
It's pretty complicated, but just to put it simply, I guess the most accurate way to look at pain is to understand that pain is just a warning signal from our brain. So pain is actually not a stimulus that goes to our brain. It's a signal produced by the brain after we've received a danger message from our body, from a body part or something. So it's actually our brain's job to interpret these messages as they're coming in from the body, and then our brain determines how threatening these messages are. Once the brain deems us to be in danger, it will use pain as a way to protect us. So our brain is constantly, whether we know it or not, it's constantly evaluating the dangers around us and determining our level of safety. So we can take that information and maybe put it in the example that we've been talking about with the plantar pot, just to make it more relatable. If we imagine bending over to pick up something heavy, and when you felt those twinges in your back, let's imagine that's when the tissue damage occurs. At the time that tissue damage occurs, you're in your garden, you're feeling safe, you're feeling happy. And so when you bend over and feel those twinges, the only threat or danger message for your brain to perceive at that moment was the discomfort that you were feeling in your back as you asked your tissues to do more than they were ready for at that moment. But if we take that same scenario and add a little bit of complexity, so maybe while you're picking up that plantar, you're noticing that you've also disrupted a hornet's nest, and there's numerous hornets swarming around you. We can even add more danger to the scenario by assuming that you might be having an allergy to insect stings. But with this scenario, your brain is perceiving the biggest threat at that time as the hornets that are going to sting you. So any twinges that you may have felt in your back as you bent over to pick up that plantar are often not perceived by your brain because they're busy worrying about the more relevant dangers of the hornet sting. So ultimately, the pain we experience is because our brain has decided for some reason that we're in danger and we need protecting. So the ultimate goal of rehab for people in chronic pain is to find out why the brain is doing what it's doing and thinking what it's thinking.
That's great. Thank you. Type in the chat if that makes sense, that it's more about a signal than damage. That's good. Good. And then, Eslyn, how would you recommend that our listeners guide their activities in their day-to-day lives, but respecting the signals they're getting from their brain?
Yeah, absolutely. So we know that pain isn't damage. So we don't have to be afraid of pain, but we also know if we push through pain, it can make things more uncomfortable and we end up being more immobilized. So one of the things that we often use is a color scale of pain. So using this color scale, it can help us to identify what we feel safe doing, what we feel unsafe doing, and everything in between. Let's again use the same example of the plantar pot. We've had that injury, and let's say a day goes by and someone says, can you pick up that plantar pot again? Well, your spidey senses go off and you say, there's no way, I'm not doing that. I feel too uncomfortable. We would deem that to be a red activity. If a few days go by, you're still a little sensitive, but you're recovering, and someone says, can you pick up that plantar pot again? You might be more open to it, but you'd like to maybe change a few things, like maybe you bend your knees more, or you might ask your partner to lift it to a table so you don't have to bend as far to pick it up. So we would categorize the need to change the environment a little bit as an orange activity, but you're still willing to consider it. And if you're thinking about, let's say a few more days go by and you're feeling more comfortable and confident, but you still have some discomfort or some awareness when you bend over to pick up that plantar pot, you're willing to do it, but it just doesn't feel normal. We would call that a yellow activity. And then let's say, 2, 3, 4 weeks go by, your tissues have healed, you're not getting sensitized, you're healing quite comfortably, and your movement feels comfortable and confident, we would call that a green activity. So categorizing your activities and your movements using this color scale can help you recognize the trends in your symptoms, but it can also be really useful when it comes to rehabilitation and trying to reintegrate the activities you love.
Yeah, that's great. I love that. Type in color in the chat if you feel that will be helpful to guide you through your activities. Good. Yeah. Okay, good. So can you tell us a little bit, the 3 different approaches to treating lower back pain?
Sure, absolutely. So one of the most common approaches I would say that most people take to managing their pain, especially in the beginning, is to ignore their pain and continue doing what they love doing, despite it causing pain and maybe nerve pain symptoms of whatever sorts. So this can be an okay strategy in the short term, but if you continue to ignore your pain, it will often end up limiting your activities and forcing you to take some time off. And then we kind of get in this yo-yo effect where you do some activities, you push through, you're committed to them, but then they're causing so much soreness and pain afterwards that it forces you to stop. And then your body starts to feel better again, and you think, oh, I'll just go try that activity until your symptoms flare again. So we see that by ignoring our pain, we'll get into this yo-yo effect, and which can often lead to more sensitivity in our nervous system.
Okay.
The second approach, we try to work towards altering or modifying your pain. So this is where the color scale comes in handy. So we can start by modifying or altering our pain by making a list of the things that we categorize as a red activity or an orange activity, and trying to limit those as much as we can. We can also consider things in this category like medication or heat, a brace or orthotics, maybe even injections. But keep in mind that these strategies usually only provide short-term or temporary relief. They can come in handy when managing your acute episodes of pain, your flare-ups. And so we can often refer to them or draw on these strategies or label them as like our flare-up toolkit. They can be there for us if we need something in the short term, but that keep in mind that's not usually our long-term strategy.
Okay, that makes sense.
The long-term strategy is the third approach, is fixing it. So we want to find the cause of your pain and we want to address the cause. So
we lost you.
You heard me? Can you hear me? Yeah. So the third category, or the third approach.
Yeah, just the third.
To fix your pain. Yep. So we could do this through a thorough assessment. We're trying to find the things that are driving your pain. Is it a nerve? Is it local tissue? Is it a sensitive brain and a nervous system? But ultimately, when it comes down to fixing it, we want to gradually confront your symptoms and expose you to the activities and the movements you want to do in a safe way. So keep in mind here, I guess one of the things we say is the thing that makes you worse is often the thing that will make you better, but in smaller, more easy to do tasks or easy to do doses.
Yeah, that's good.
So I'll just add
for sure.
One last thing, then we'll move on. I'm on a roll. So I guess the last thing I would say, I think, actually, you know what, that's probably a good place to wrap up.
Cut you off. I'm sorry about that. Didn't mean to do that.
No, I have one more thought, but I've lost it. So
sorry. So who's interested in getting their pain fixed? Like, who's interested in getting to the root of this problem and fixing their pain? Yeah, so definitely people are interested. So what we're going to do now, hopefully you'll still be able to, everyone, yeah. Hopefully you'll be able to hear me well. I'm going to disconnect for a bit my audio, so and then we'll get everybody standing and moving. What we'll do, we'll go through an exercise, similar way that we would do it in the clinic, as if somebody has hurt their back, bending, and kind of like what Jason was saying. And then we'll use that color of scale to help you get back and see how we would do a movement, okay? So I'll just unplug, just bear with me for a bit. Good, can you guys still hear me okay?
Yep, perfect.
Okay, perfect. So yeah, so everyone, you can stand up if it's doable for you where you are. And then let's do it here. Perfect. So just as a disclaimer, I guess, before we get going, is like making sure, because we're all remote and you know, we haven't assessed any of you, making sure you stay in your green to yellow zone when we're doing this. Okay, that's super important. And then if you do that, you'll be okay. Okay, because you're listening to the signals. Okay. So when we're looking at back, being afraid of bending forward with that is like often people, they end up stiffening their back and then they're afraid to go further or the pain is limiting them, okay? So that's an okay strategy at the beginning, like has been said, to avoid it, but then to have a full recovery, you have to get the movement retrained and get your brain not to feel the threat when you're doing it, okay? So there's a component of like bend, like hinging at the hips. There's a component of rounding, and then it's tying it all together and making sure that it's a smooth, fluid movement after that. Okay. So let's do a test before, so you can do it before and after to see how your symptoms are. Okay. So if bending forward is a challenging activity for you, try it right now and then see what's your limiting factor. If you're at about your knees and that's where you feel like there's pain, maybe more of that orangey red zone, then stop there and then we'll reassess afterwards how you feel, okay? And an important thing to recognize that when pain has been there for a long time, when your nervous system is very sensitized, what we see is that yellow zone where you're usually allowed to work in, your buffer zone, we can call it too, sometimes can be so small that it doesn't give you a lot of room before you spill into the orange or red, okay? So recognizing that, maybe stay more in the light yellow zone when you're doing your movements, okay? So the first one, maybe hold on to your the back of your chair or your desk, that would also work. And then just practice, oh, maybe I'll just put it a bigger screen so you guys can see me better. And then I think, is that better in terms of the image?
Yeah, I think it looks good.
Yeah, okay, perfect, good. So we're gonna do hip hinging, so into this position. And then let's say it's here, if you start to feel uncomfortable, then you would not want to try to go beyond that. You would want to stay there. So breathing in as you go back, breathing out as you come up, and then you don't try to hold it at the back. So you want to get to your yellow zone, but not through it. And you want to repeat this motion 5 to 8 times, okay? And it's often less sensitive for the nervous system if we don't hold this movement, if we just go slowly in and out of it, okay? So we would recommend that you do this like 5 to 8 times, and then what we're expecting to see is like the more you repeat this, the calmer like it should feel. You either have more range or it's more going into the green zone, okay? So the next one you can try after that is more to help with the rounding. So you can either put your hands on your thighs and just practice getting into an angry cat position and then more into an arch back, or you can still use your desk or the back of your chair to do that. So rounding and arching and breathing fluidly as you're going through these motions. Because another signal that your brain can give you is that when it starts to feel threatened, you'll start to hold your breath. So if that's the case, if you're noticing that pattern, it's probably a sign that you're pushing a little bit too close to that vulnerable zone, okay? So ease into that and just get that nice ocean breath in and out as you're moving through those, okay? So after you've done 5 to 8 of the hinging, and then 5 to 8 of the rounding and that, then you can try combining them together, okay? So you can think of just picking up clouds or fall leaves and then just bending gently. So allowing your hips to sink back, allowing some softness in your back, and then just extending up again and just kind of throwing those leaves up in the air. And you can make this motion as small as it feels comfortable and safe for you, or as big as it feels good, okay? And then the same idea, you would repeat this like fluid motion 5 to 8 times, okay? So what I would recommend then after you've done that is that you try to do your same reaching forward again. So what we're hoping to see there in the clinic is that, or at home right now, you'll be able to tell me if there was any changes, but you would either see like an increase in your range of motion and therefore the pain would be further, you know, happening further away in the movement, or it could be the same range of motion but less pain. Okay, so those would be 2 good options. And then sometimes it's not the right fit for you at this time, right? It's maybe too threatening for your back. So we would simply change the activity. We're not a fan of like trying to be too nitpicky about it. If it's not working out, it's just not the right one to start. And that's our job. That's what we're here to help you figure out and making sure that you're able to do them. Make those, yeah, exactly. So somebody's typing in the chat that they couldn't do those movements. So listen to that, and that's not unusual because maybe that's too advanced for you right now, too close to your threat. Okay, so it doesn't mean that you're, you know, that you can't succeed from this approach or anything like that. It just basically means that for that particular movement at this particular time, your nervous system is feeling that threatening. Okay, so let's go back into here, and can you guys share with us more about like your biggest takeaways so far in this session? I'll just find the chat again. Okay, or if you have any questions. Somebody I think earlier had a question about mattresses. We can answer that.
If you look in the Q&A, we also have a question about degenerative disc disease.
Yeah, oh, I missed that part. So yeah, so grading, so we'll start with the big takeaways. So okay, grading the level of pain and sensitivity, that's good. So that was a big takeaway for Tamsin. So that's good. Any other good takeaways from you guys? Gentle movement is part of this solution, that's good. And then Jason, you were saying there's in a Q&A, there's one?
Yeah, I just saw the little icon there in the Q&A. Someone had, someone anonymous, just had a question with regards to which of these types of pain is related to degenerative disc disease, which is commonly, which is extremely common as one ages. Do I want to answer it? Yeah. So so degenerative disc disease, just a way to dumb it down, I would say, is that it's an age-related change. It's just a natural process that the body goes through as you just live your life, expose your back to certain stresses and strains and activities or what have you, the bumps that you get along the road of life. And so the back kind of, the joints will build up callus, try to protect itself. The same way that, you know, we work hard with our hands, we get calluses on our hands. Well, it's the same thing. But this time here, when it involves bones, we end up getting more of a growth of bones to protect the sort of calcium or what have you, to protect the joints in the spine. And so when we're talking about degenerative disc disease, it kind of falls into, I would say it could potentially be all three categories depending on how it actually puts stress or strain on the body. When I was saying with the local tissue, well, if the joints are inflamed, if the joints are swollen and irritated or what have you, well, those threat signals, as Essen was talking about earlier, that gets sent to the brain. So the brain is perceiving the inflammation that's going on in the back as something threatening, so you can have pain for that. Since we're talking about something that's along the lines of an arthritis, well, this can last for a period of time. People kind of, you know, experience the occasional back pain. Some of my patients, especially like right now, the kind of weather that we have here in Ottawa, some of my patients are complaining about their joints bothering them, etc. So then we can fall into the third category of central sensitization, because there's constant signals being sent to the brain, etc. So then, even though your degenerative disc disease might not actively be irritating you because of the chronicity of it, well, any kind of slight movement or what have you can kind of trigger everything back up again because the brain's been trained to think that there's something going on with the low back. And also it falls into the peripheral neuropathy, depending on how much protection is being built up in and around the spine. Well, if the nerve that's exiting the spine is getting squeezed a little bit, well, then you can also have a little bit of peripheral neuropathy type issues as well. So a good question. It basically, it falls into kind of all three, but that definitely degenerative disc disease, I would say for sure is a number three in there, the central sensitization for sure.
And I'll just add a little snippet on top of that is sometimes we can have degenerative disc disease that shows up on someone's imaging that actually isn't the reason for our pain. So, I think we have a really, we're hypersensitive to the word disease. And so when we often hear the word degenerative disc disease, we think it's a bigger issue than what it is. But if we can, like a lot of the research these days is really using the term the wrinkles on the inside or gray hair of the spine. These are changes that are happening that may not always be the reason for your pain. So there is nobody over the age of 40 that 30 even that's going to have an absence of some degenerative changes. We're all going to have, you know, gray hair showing up around 25 and our eyesight changes. All this stuff is happening just like degenerative changes happen in the spine as we age. So when you talk about a diagnosis like that, we're really needing to clarify, is it symptomatic like Jay just discussed, or is this just what someone saw on an image and may actually not be the reason for the pain that you have?
It appears very often to be a quick excuse for your pain without putting much thought into why you're actually experiencing your pain. So it's like, oh, well, clearly these x-rays are showing this as this, so therefore, yeah, it's degenerative disc disease. It is what it is. So yeah, it can be kind of unfair for a lot of people.
Good. There was one comment about like if we can talk about a bad mattress. I would simply say, I mean, that's a whole other topic, I guess, but in terms of like your mattress and, you know, your sleep system, something that sometimes there is a real problem with your sleep system. You know, if your mattress is starting to show significant wearing signs, then yes, it's a good idea to look at investment and changing that. But again, you know, just like a chair or other things, is like, it depends how much support you need and feel. Some people prefer to have a softer mattress, other more supportive. I think the important thing is that your sleep system, you feel supported, you know, the curvatures of your spine feel supported, and that whether you help with that with, you know, a lot of people use a Tempur-Pedic and stuff like that, the mattress toppers, or you use pillows, but also recognizing that that might be a sign of that central sensitivity, right? Because, you know, people often say, oh, the side of my hips are hurting when I'm sleeping. Well, sleeping should not be something that should be that sensitive, right? It's just a normal, non-threatening pressure, but for a lot of people, it is. So if there's no obvious signs of wear and tear in your mattress, maybe it's not the mattress, maybe it is again that nervous system. So just a little thing to keep in mind. Okay. There's, I think maybe one more comment.
There's one question here about how we feel about compression garments. I think garments is what was meant, like t-shirts.
Okay, didn't see that. Yeah, okay.
Yeah,
can...
that's I guess it's, I'll try to answer it, but when it comes to something like that, the way I perceive it is that when you're getting these compression type clothing, what's happening is there's just an unusual amount of pressure that's happening, and that kind of just wakes up, let's say, like a response from muscles in the area. It's kind of like it adds a little bit of extra strength to the muscles. So I think it helps people feel safe, you know, but it's definitely, I would say it's good. It's good in the interim. I think if you're someone who requires to get these compression type clothing, then I would say there's something that needs to be worked on from a strength stability point of view.
Yeah, and maybe like as I was saying, maybe a good solution to alter the symptoms, you know, part of that kind of a little bit of a bracing. And depending if it's like a postpartum, I know I work lots with women with postpartum and so on. So sometimes they need a little bit of that extra support immediately after delivery in the early few weeks after delivery, just because their connective tissue is so lax. But yeah, that would be one zone again that in a temporary use, that would be okay. Good.
Can I just interrupt? Like, I'm just noticing in the chat, there's a comment here from Meredith that asks, how can we break the cycle of chronic pain? She's done physio, massage, injections, needling, etc. for 2+ years and still has pain.
Ah, I didn't see that. Yeah.
I think just it's a really complicated, big answer, but it really comes down to, we need to treat the whole person, right? We need to treat your whole being. We can't just attack the muscle that's sore, stretch the muscle that's tight, or strengthen the muscle that's weak and think that that's going to impact your entire being. So I think it starts with getting a connection with a practitioner that can see the whole you, and start with finding little movements or activities that you feel safe doing, and exploring that color scale that we chatted about, and just working in gradually little things that you can do, and trying to turn the momentum of the treatment more on you, trying to find what you can do, what you feel safe, comfortable, rather than what we can do for you, because we don't want you to just feel like you need physio all the time or massage all the time. We want you to feel like those are adjuncts to your treatment, but the real bread and butter of the treatment is looking how we can calm your brain and calm your body. And there's lots of different tools that help us to identify where you would benefit and what we can do for treating the whole.
I think that's a good point, is then to look at it as, you know, like we were talking about earlier, multi-systems, and then also, you know, a team approach. Like sometimes also working with a psychotherapist as part of our team to help you with our stress or anxiety, those type of contributing factors to our persistent pain. Okay, so there's lots to address in that whole body, a whole person approach, right?
Absolutely.
And just one last comment on that is just to really understand what pain means. So I think part of this webinar that we're doing here is hoping to get you guys to ask questions. We're not going to be able to answer everything here. We're not going to be able to give everyone an individualized plan, but to be able to say, I didn't realize that pain doesn't equal damage. That maybe I can have a little pain and I'm not hurting myself more as I bend over to try to make my bed, or if I try to walk down the stairs or whatever. Yeah.
And I think that brings us to our next step, is like, if you're feeling, you know, inspired and you want to get, you know, improve in your pain journey, it is really that, it is a journey. Often we think like, okay, I'm ready, I'm going to get this done. And we think like, yeah, I'm going to set my goal and it's going to be a nice gradual uphill towards what I want to get. But we all know that it's not that easy, in the sense like there's going to be some ups and downs, and you're going to get obstacles, and it's part of the journey. And that's the role, that's our job, that's what we're here to support you, and trying to figure out solutions when these type of things arise, and also understanding that you don't need to do this alone, right? Like if it was that easy to figure out, that your body would have already figured out by now, right? And you wouldn't be sitting at this workshop today and trying to get more answers to why your pain is persisting. Okay, so I think we'll do in terms of yeah, somebody's like in agreement with that, but what I would say is we'll start wrapping up. So we'll answer if there's unanswered questions in the chat. That's okay. I just want to make sure that we're not keeping you over time, and then that, you know, people can still reach out to us if they want. So basically from this point is like you have two options. Basically, if you're feeling ready to move with us, we're offering like a back assessment. Normally these back assessments are 1 hour, but to thank you for you know, attending our workshop and listening to our tips that we had suggested today, we're offering a little bit of a longer session, so 70 minutes. There is a fee for that, but we're confident you'll feel that is very valuable. And then we'll do a detailed assessment of your history. What's your journey so far? What worked? Where were your you know, where do you think it didn't go well, or what areas that you feel might have been not looked at, and then we'll go through those different systems in helping you figure that out, and more importantly, we'll get you started on those first steps to get you towards your pain-free goals. Okay, so in the chat you can type back if that's something you're interested in, and then we'll connect with you within the next few days to arrange that back assessment. And then the other option is, if you feel like that was a lot of valuable information but it's a little bit overload, that's okay too, you know. Take your time, digest it. We have an option for a cheat sheet, so just type sheet in the chat, and then basically we'll give you the color scale of pain that you can reflect back on and have it as a visual tool, so you can, yeah, okay, this is what it means. And also we have the little handout of the 3 movement that we did today. And like I said, if you know, those movements are not the key for you, it's just an example that was going with what we did with our lifting injury that we do find is helpful clinically, but don't feel like that's the only solution for your back. And that's why we can do those more one-on-one sessions with you guys. Okay, so I really hope that, you know, you found value in this, and that you have found maybe one valuable piece of information that you can start right away. So yeah, so we'll put all of the names of the people who participated in the chat. Who enjoyed this workshop, just type, you know, on 0 to 10, give me a number. 0, waste of your time. 10, amazing. And then, yeah, honestly, like we want the feedback, right? So we want this, like our hearts are in this. We really want this to be, you know, valuable. And then how can we make it better, right? So we'll give you the opportunity to give your honest feedback and see how we could have made this even better for you. Okay, so yeah, thank you so much, Eslin and Jason, for all your amazing you know, feedback. Wrong window. And then yeah, we look forward to connecting with more of you over the next few weeks. Okay, take care, everybody.
Bye. Take care, guys.
Take care, everyone.
Okay, take care. Bye, guys. Bye.